Matters. Welcome to another episode from the show Family Matters. This show tackles all issues related to family, whether psychological, spiritual, or health-wise. I will bring ideas to help you where we are. This is meter to January 2022. The number of cases in the whole world exceeding a million. Happened during the latter part of January and basically the beginning of the year. However, strangely enough, this wave does not carry a very high wave of death. If you remember last year, exactly the same time, in January 22nd, 2021, there was 16,000, 17,000 deaths per day. Today's number of deaths across the world is less than half of this number. What is this telling us? Telling us that the virus is still out there, but definitely this type of variant, who people are giving it the name of Omicron. Omicron is a new virus that started in end of November in South Africa and Botswana and rapidly spread all over the world, to the extent Omicron became the most common virus mutation across the world today. Just for you to understand what is this virus looking like, I want you to look at this graph. So the Omicron shares with Delta only on those blue lines, 1, 2, 3, 4, 5, 6, 7. Omicron as a new variant is only similar to the alpha, beta, gamma, and delta in few areas of mutations. However, the spike protein of the SARS-CoV-2 in the Omicron has been so different, and look at the number of variations and mutations in red that the virologists and scientists have found. It's almost like a new virus. And because of that, this virus is really considered a very virulent virus in the form of that it is spreading so fast, and it's quite different than its previous mutated viruses like the Delta or the Alpha. This type of virus actually is considered very fast spreading, to the extent in December 18, the weekly cases in New York City among non-fully vaccinated was almost 4,000 cases per 100,000, while it is far less among the vaccinated. If we look at the weekly hospitalization just in New York City, among non-fully vaccinated versus vaccinated. So this graph shows two things. Number one, it's rapidly spreading. But number two, which is very important, it's far less spreading among unvaccinated or non-fully vaccinated. And number three, it's allowing a lot of hospitalization among unvaccinated. So basically, this type of virus not only spreading fast, but also, number two, going to those who are unfully vaccinated and getting them to be hospitalized much more than those who are vaccinated. What does that mean? It means that this virus is not going away anytime soon. This is our pattern and new life in the coming years. Probably 2 to 5 years from now, we'll still be living every now and then with a new mutated virus. Until 90% of the whole world, which is close to 7 billion people, vaccinated, the virus will keep mutating. The good thing, however, that the South African scientists who first discovered the Omicron virus found something very interesting and promising. Those who were infected with Omicron were not affected by Delta when they were exposed to Delta. And to remind you, Delta is the much worse type of infection, which I'll come back to very soon. What are the clinical differences? So they found in a small group of patients, but still very valid, those who were infected with Omicron were immune against Delta virus. The Delta virus is the one who was getting people on a ventilator. The Delta virus is the one that was affecting their breathing. The Delta virus is the one who was causing significant oxygen deprivation. Omicron, on the other hand, the only thing it's causing is sore throat, very bad sore throat, temperature but not very high, cough but not very bad, and no effect, generally speaking, no effect on the respiratory system. It's basically from here to here. We call it upper respiratory tract viral infection. The Delta, however, was a lower respiratory tract infection, was affecting the lung, the alveoli, the bronchi, causing pneumonias, causing respiratory failure, causing respiratory infections. The Omicron is only affecting the sore throat and is not even causing significant symptoms of loss of taste, of loss of smell. So it's a better virus, if there is anything called better virus, because number one, it's giving us immunity from Delta, and the Delta is the fatal one. Two, it's actually not causing significant bad symptoms. I personally was infected a week ago, and 2 weeks ago, and within a week I'm back to normal. And I have been helping so many people who have Omicron, and I'm yet to find except one who maybe he did not have Omicron, he maybe have Delta, who need to be admitted to a hospital. Basically sore throat, cough, fever, body aches. And in 3 days, you should get better if you are vaccinated. If you are not vaccinated, the virus takes a toll on you because it becomes much more fierce. Those who are unvaccinated and develop Omicron, unfortunately, are more prone to be admitted to the hospital, are more prone to get pneumonias, are more prone to get long period of needing to recover. The people who are vaccinated or even better off boosted, they are fast recovering and with very little delayed or residual symptoms. New York Times showed in a very nice article only on January 6. This is last week patterns of infection. As I told you, this is probably the third or fourth wave. These are the number of cases. And this is a 7-day rolling average. And as you can see, it was spreading even more than the Delta virus. Strangely, however, the hospitalization was far less when we were talking about it last year. And if you talk about death, It's far, far less compared where we were. We were about 120,000 deaths per day last year in the world. Now we are talking about 1,400 in the States. This is a completely different picture from Delta virus. One, because Omicron is lesser of an active virus. Two, because Omicron is giving us immunity against Delta. Three, because we are far more vaccinated today. The number of millions of people vaccinated, at least in this country, are far better in number than when we were at the time of January 21. And that's why the deaths have gone down, hospitalization gone down, but the spread is still going on. And I don't want people to doubt the vaccine because it's spreading. Unfortunately, as long as the virus keeps mutated, because not all people are vaccinated, we will keep getting mutated viruses. But the most important factor, those who are vaccinated and those especially who are boosted are not being admitted and not dying. This is basically the summary of last week. Over 1 million affected up to January 4th or 3rd. 1 in 100 Americans testing positive during the first week of the year. Hospitalization raised to 41% in the first 2 weeks. 1 million US COVID cases in 1 day. This is what I was saying about the vaccine. The vaccine, while is very effective against Delta, after 4 to 6 months, the antibodies go down significantly. I am quoting a report from CDC. Reports from December indicated antibodies in people who only got 2 doses of Moderna messenger RNA vaccine were at least 50 times less effective at neutralizing the Omicron. And a study released last week by the UK Health Security Agency found that 20 weeks after the second dose of a messenger RNA, protection goes down to just 10%. However, with the third booster dose, though, protection rocketed up to 90%. What does that say? It says that we cannot depend on a vaccine more than 4 months. And I know that sounds crazy, and most of you will say, enough with this, I'm not going to take more vaccines. I'm not here to sell anyone a vaccine. I don't have any financial interest in any company. I don't have even stocks in any company. So I have no interest except the interests of the people I serve. So scientifically speaking, the vaccine has been protecting us from the main virus, which is the Delta. Omicron changed a lot its color, types, genetic makeup, and our genetic antibodies from the 2 doses of Moderna or Pfizer have been 50 times less effective after 4 months. The reason is the antibodies dramatically go down between 4 and 6 months from the last dose. And hence, we needed the booster dose. And I know some of you will say, why should I take the booster dose? And it's not really fair. And I had enough of the vaccine and I'm not taking it anymore. But I can tell you, it's your call. I'm only here to advise, and it's your call to decide. One of the main questions families are asking, should I take the booster or not? And the reason you ought to take the booster is because your antibodies against the virus, let alone the type of the virus, goes down dramatically 5 months post last vaccination. And that's why the Israeli scientists are recommending already the fifth type of vaccination, as you can see in their paper. This study came on January 4, 2022, and the researchers from Israel reported promising preliminary findings from a study on a fourth COVID-19 vaccine shot. And basically they found that from Sheba Medical Center near Tel Aviv launched a study in 154 hospital workers to examine safety and antibodies. All had their first booster before August 20 and had antibody readings below 700. And that's why they are now recommending a fourth COVID vaccine, and that showed 5-fold increase in the number of antibodies. So while most of you may be skeptical about taking boosters, I can tell you from a medical and a physician point of view, although I am not an ICU doctor, but very close to hospital administration and listening to the numbers and how many ICU patients and how many doctors and how many nurses getting infected, please consider, that's all what I can say, consider taking the booster for you and for your family members. Because the booster will allow you to get antibodies within a week, 5-fold what it used to be, and you will be able to attack another virus or mutated virus. Whether we will be in this country following the Israelis' researchers, and we need to get a fourth vaccine, that remain to be seen. So the next question that I get asked, how about which vaccine I should take as a booster? If you are convinced to take the booster, I can tell you can take anyone. However, there was a recent study published in New England Journal of Medicine. And people who have taken Johnson & Johnson should not take Johnson & Johnson as a third booster. They should take Moderna, which a little better than Pfizer. If you have taken Moderna or Pfizer, you can take the same one, or you can mix and match, as you can see in this paper in front of you, that FDA authorized mixing because of the article I mentioned in New England Journal of Medicine came early this year, showing people taking Moderna after Pfizer have slightly, not significant, but slightly higher antibodies than if we were have taken Pfizer after Pfizer. So there may be a slight benefit of mixing and matching, especially Moderna after Pfizer. Moderna after Moderna or Pfizer after Moderna is the same. If you have taken Moderna before, you have the right to take either Moderna or Pfizer. However, when the study was done, was taking double the dose that's being offered. The third dose of Moderna today is 50% of the prior doses, not 100%. It's half of the dose, but still, it should be as effective as the first two doses. So in summary, you need to take the third vaccine, or I recommend you take the third vaccine. If you have taken J&J, I would advise you against another J&J, but rather messenger RNA, probably Pfizer or better off Moderna. If you have taken Moderna, you can take either Moderna or Pfizer, both are the same. If you have taken Pfizer, Moderna is slightly better than Pfizer. But if you wish to take Pfizer, no problems. Side effects from the booster are similar to the prior ones. Moderna has a little bit of more side effects. And I mean side effects meaning viral-like infection. Aches, headaches, fever, body aches, pain in the arm, and sometimes a lymph node under the arm. I want to warn my ladies, do not do a mammogram 3 months post-vaccination. I have seen many women come with a lymph node under their arm, and then the doctors who are not quite experienced, they will start asking for biopsy of the breast, biopsy of the lymph node. This is just a reactive node from the vaccination. Please do not take a mammogram minimum 3 months post-vaccination. So I will answer some of the questions now, and then I'll come back to the rest of the presentation. I am fully vaccinated with Pfizer. I got the booster on November 26. However, in less than 6 months from getting my booster, I got infected from my 13-year-old son, who was tested positive on January 8, and his last second Pfizer vaccine was taken on July 21. I am 46. I do not have major health issues except hypertension, which is under control. I don't get sick easily. The issue that I start to see mild symptoms for 2 days starting January 10. However, since yesterday, I start to have fever 103 with severe fatigue. My oxygen dropped from 98 to 93. I called my family doctor. He ordered medication, advised to monitor the case. Next step will be going to urgent care. So, number one, I am not surprised you got infected from your son. I am a little surprised that your oxygen is low, which maybe this is a non-Omicron infection, which would be very troubling if you got it after the third booster. More than likely, your oxygen will go back to normal. I don't want you to panic. This is the case. Sometimes I put you on steroids. You can ask your medical doctor. I think a trial of 5 days steroids should help in your case, but I want you not to panic. You are going to be completely relieved from this infection, and please follow up with me if you wish. Another question. I'm just wondering how effective is the vaccine since it was recommended for people who has weak immunity to get the booster. I actually did from 6 weeks only. So the booster is not just for immune compromised, although the fourth will be only offered to immune compromised. I have a feeling they will offer it to doctors and nurses because we are getting infected right and left this time. I want to get back to the CDC study that they found 95% of those who got Moderna for the first round shots chose Moderna for the booster, which is the right thing. If you want to choose Pfizer, that's okay. If you are Pfizer, I recommend you take Moderna, but nothing wrong if you take Pfizer. If you take J&J, definitely don't take J&J, but take messenger RNA, which is Pfizer or Moderna. Now, what about the kids? I just got a question saying, how safe? Good evening. After how? No, that's not the question I want to answer yet. How safe is a vaccine from ages 5 to 11? So, to answer this question, do young kids need COVID 19 vaccine. According to the American Academy of Pediatrics, reported last week that 7.9 million children have tested positive for COVID-19 since the beginning of the pandemic. 1 in 10 children. Children do typically remain at a low risk of severe COVID, and they have rarely have complications due to COVID, including long COVID or what we call multi-system syndrome. For the pediatric population, children 5 years and older can get Pfizer, not Moderna. It wasn't tested yet. Children from 5 to 11 years old can receive a separate vaccine, which is the orange cap, which is half of the dose of the adults. And when they reviewed the safety, they found it quite safe. Children below 5, meaning 2 to 4, they are not being vaccinated at the present time, but it's being studied. There is a current study going on between 6 months and 5 years, and this study is not available for public use yet. So, to answer your question, excuse me, from 12 to 18, they get exactly like adults, whether Moderna, Pfizer. If you are 5 to 11, it's safe to get the vaccine, but they will give it only Pfizer, and it's going to be the orange cap, which is half of the dose. Safety measures have been tested, and this slide shows you how the CDC recommends for all ages. So let me run you through it. Yeah. So regarding the Pfizer vaccine, the Pfizer vaccine, those are eligible to it. Patients, people who are age 5 and plus, who are moderately or severely immune compromised, meaning kids who have leukemias or rheumatoid arthritis or things like that. This is for the primary shot. And the second shot is given 28 days after. The booster is not recommended for children, but recommended for children between 12 and 17. Those who are 18 years and above should get a booster, shot of either Pfizer or Moderna. Regarding the Moderna, Moderna is not prescribed to anyone less than 18. We don't have any studies opened or published yet. So 18 and above, you can get an additional primary shot, and the second shot is given after 28 days. Some people say Moderna can be given after 3 weeks. The booster shot is okay for people who got Moderna, and usually is given 5 months after the second shot. If you wish to take Pfizer after Moderna, is allowed. For those who are taking Johnson & Johnson, so Johnson & Johnson, no additional primary shot is recommended at the present time. People are 18 and above can get a booster shot, and you can get any of the 3. And because Johnson was weak, we recommend that the booster is given 2 months after 1 shot. As you know, Johnson & Johnson is only given 1 shot. So we are not here talking about 2 shots. So 2 months after J&J, you should get Moderna or Pfizer. I do not recommend you take J&J. The study was weak as far as, okay. Now, what is, let me answer this question. How safe is the vaccine from 5 to 11? I answered this question. Another question. Good evening. How long after the infection of COVID-19 we can take the booster shot? Very interesting question, because I used to say 1 month. CDC and Johns Hopkins and other universities have recommended as soon as the symptoms are resolved, you can take the booster vaccine. You don't have to wait a month. If I were you, I would wait a week to 2 weeks after the end of the last symptom. So if you had fever ending today, I would wait minimum another week to 2 weeks. If you still have cough, I would rather wait 1 to 2 weeks until the cough is gone. Okay. Now, let me move to a different topic, which is very interesting, and I want people to be aware of it, which is the topic about monoclonal antibodies. What is monoclonal antibodies? Monoclonal antibodies is an infusion, is an intravenous infusion given over usually 2 hours. And there is several of them, some by Lilly, some by Janssen. And basically, those medications are really, if you notice, this is the Omicron, which is in red. Strangely, the casirivimab, the imidivimab, and even both of them do not affect Omicron. Omicron was not treated well by those medications. As you can see, the Delta was very much well affected. The best ones, which is the yellow, which is the Alpha 1, defeated by these medications. So when we used to get people who are over 60, have kidney problem, have liver problem, obese, heart problems, we used to give them monoclonal antibodies of these medications. Strangely, however, these medications were not working on the Omicron. As you can see, the Omicron is 100%, was not as if you didn't take the medication. While the beta virus was affected to 20%, the alpha virus is almost completely eradicated by any of these medications. Now, if I would look at the new medication called sotrovimab, and sotrovimab is the only medication that really can stop Omicron. So the friend of mine who just sent me a message, I would recommend that you should go and get monoclonal antibodies. And if you don't know how to get it, please contact me. I will be able to get you this medicine because you seem like your oxygen is low or getting low, and I would rather help you with that. So the person who reached out to me, and I don't have his name, but please connect with me after the session. I'll be trying to get you, hopefully, if not tomorrow, then Monday, to get sotrovimab, which is the only one can kill the Omicron at the level of 50%. None of the other monoclonal antibodies were. Now, there is a caveat here. The caveat is, unfortunately, these medications are in great shortage. And it's very difficult to find monoclonal antibodies. And that's why they are only prescribed for those who have significant symptoms, like the brother who just asked a question. Okay. Now, let me move to another important study, which is what is going on with the tablets, or what we call the antiviral. And I'm going to also use scientific data, so you think I am not really using my own knowledge, but rather all publications. This is just came, and basically it's showing us that remdesivir, which is an antiviral well-known, and anything that has a vir at the end, basically those are all the anti-COVID tablets. For the first time, we have an antiviral tablet can be brought. Unfortunately, again, there is a big shortage of it, but hospitals have it. And if you are sick enough to go to a hospital, they will give you the remdesivir, or even the stronger ones, which is the nirmatrelvir or the molnupiravir. Again, those are new medications, just went by FDA for emergency use. Of course, there is no long-term studies, but for emergency use only, and for those who may not be able to get monoclonal, there is a promise by the government that these medications will be available very shortly. This is a major breakthrough, because if we do have the antiviral, this medication will act against all the variants, not just the Delta or the Omicron, but even the new one. Okay. All right. Now, I want to summarize what I commented about from the beginning. Number one, I want to say that Omicron is the most common variant available in the world today. It has good and bad things. The bad, that it's spreading like fire. Almost every family has at least one person got infected. And unfortunately, it does not differentiate a lot between vaccinated and not, except for, and that's the good part, it does not cause severe infection for those who are vaccinated. Majority of people are not admitted to a hospital. Majority of people do not get a lung infection, but rather just a throat infection or upper respiratory tract. The next thing I want to say, that the fully vaccinated are still avoiding the hospital and certainly avoiding to die from the virus. As I mentioned also, although there is a rapid spreading infection, there is no parallel people admitted to the hospital, intubated, or dying like last year, same time. Messenger RNA vaccines are effective. However, their effectiveness wanes off about 5 months from the last dose. So people should be considering to take the booster dose, the third vaccine. If you haven't taken the second, you take it. And you should take your booster 5 months, minimum 5 months, maximum 5 months after the last dose. If you have taken J&J, after one dose, you should take the Moderna or Pfizer 2 months after the vaccine. I also mentioned that you can mix and match, and the booster can be Moderna or Pfizer if you have taken either of them, and Moderna or Pfizer if you have taken J&J. And when do you take the vaccine? You could take it as soon as your symptoms are resolved. The American Pediatrics Academy have reported safety from 5 to 11 years of age to take the vaccine. And of course, the only vaccine available to children is a half of the dose of Pfizer. I also discussed that the only medication available as a monoclonal antibody is called the sotrovimab, and that's short. There is a shortage, but available in hospitals for those who are candidate for it. The rest of the antibodies do not work well against the Omicron. I mentioned that the available antiviral medications are now in the market, again in shortage, and again not in a total supply yet, and there will be significant indications and restrictions who should be using it. Now, not to scare you, but unfortunately, there may be another virus on another mutation coming up from France. Basically a new virus called IHU. I'm not sure how to pronounce that. And they claim it's also going to be very effective and rapidly progressing, but we are not sure yet if the vaccine will combat it or not. If it is, then thank God. This is the report that came on January 4th, that IHU from France. When do you take the full? How long should I quarantine if I am? Yeah, very good question. So the quarantining now is 7 days. It used to be 10, became 7. And it's a bit controversial. And let me explain to you what I mean by that. In the medical field, we go back to work within 5 days. Is that safe? I'm not sure. The reason I'm saying I'm not sure that we may be still carrying the virus. However, there is a huge shortage among medical personnel, nurses and physicians, that we can't afford to stay home. For the public, 7 days is recommended, provided you are vaccinated 2 doses minimum, provided you have no symptoms for at least 3 days. If you still have symptoms or unvaccinated, you should not leave your quarantine yet. Regardless if you are 13 years old, which is the child who just sent me a message, if you are 13, you still 7 days from the day you are diagnosed. However, you have to have been vaccinated before and no symptoms. If you are unvaccinated or have symptoms, you have to stay 2 weeks. Another question. How about lots of reported myocarditis, pericarditis cases among children and youth who took the messenger RNA? I have studied this very, very much. And thank you for your question. Myocarditis and epicarditis, basically, they found cases in children, especially in the age of 16 to 24, that there is an inflammation of the heart muscle and sometimes the covering of the heart called the pericardium. So it could be pericarditis or myocarditis. Now, 99 point I know what, all recovered very well. There is a very, very, very tiny small percentage of people getting infected. But when they compare that to the huge incidence of what they call multi-system infection, which unfortunately people, when they get infected, sometimes they die from it, and the death happens to those who are young, 16 to 24. They found that the best is to get the vaccine. Otherwise, the immune multi-system immune compromised. I forgot the MIS stands for, but syndrome, multi-system immune compromised syndrome. Those, and I have one person who I know very well, unfortunately 16 years old, in the southern states. He is currently intubated, was not vaccinated. He is intubated now for 12 days. He has kidney, heart, and liver failure because of COVID. So I know what you are thinking. Unfortunately, there is a bit of a decision you have to take. The chance of myo or pericarditis are so rare. They are true, though. It can happen from the vaccine. But the incidence of multi-system immune-related syndrome is far worse and far common from the virus. So thank you for your question, and I agree with you. We should hopefully pray that it will never happen again. If you want to take the flu vaccine, you can take the flu vaccine with the COVID vaccine. You don't have to stop taking the vaccine because of this. Some people are asking how many people dying from the vaccine. I really don't know, but I can tell you how kids dying from COVID. So there is a state, the American Academy of Pediatrics have just reported this past Tuesday, January 13. I'm trying to find if I can show it to you. Okay, let me just show you this. So to answer her question, this is the American Academy of Pediatrics. This is published on now, 2 days ago, January 13. Was supposed to be posted in 2 days. Or maybe this is last year, I actually don't know. But let me just read the data. No, this is this year. So as of January 6, this is the cumulative number of COVID-19 cases. 8 million COVID-19 cases among children, representing 17% of all the cases. Overall rate is 11 per 100,000. What happened, the change on COVID-19 cases among children? During the past week, which is December 30 to January 6, there was a much higher number, 580,000 children, compared to, I'm not sure if they are saying, were reported, 580 reported past week. Over 2 weeks period, there was 12% increase in the cumulative number of cases. Hospitalization among children, among states reporting, children range from 1 to 4% of the hospitalization. Basically around 1% children hospitalization. Let's talk about cumulative mortality. Among states reporting, 0 to 0.2.7 of all COVID-19 death. In the states reporting 0 to 0.2, COVID resulted in death. So it's very, very rare. They're saying we are no longer reporting testing, I guess because there are so many testing already happening. So to answer your question, I don't know if this has answered your question, but I can tell you they are more resilient. Definitely their severe infection is far less than adults, if you're talking about children 5 and less. Definitely they are the source of the Omicron now, and that's why a lot of schools are closing some of the classes, because the children are the ones who got affected because they were not vaccinated, and they are sending the infection to their grandparents and parents. I think I covered all the questions, and I think our time is up. I just want to show one last promising slide. And this is a hospital in New York. And for the first time this week, we start seeing, it seems we reached the peak in January 10, and it seems we are about to go down in the number of COVID. This is very promising, and this is not just one hospital. I have seen it in many other hospitals. So keep fingers crossed. God willing, we reached the peak, and now we are going to go down, and worse had become behind us. Now, that doesn't mean, number one, that doesn't mean you take your mask off. I think the mask is proven to be the most important barrier to the infection. Number two, if you have any symptoms, please do not go out, whether it's flu or not flu. Number three, if you have somebody who got infected in your family, please stay within your family. Don't go out. More than likely, you are being infected, even if you don't have symptoms. Number four, I cannot tell you what to do about vaccination, but I and my family and the extended family are all vaccinated. And I'm a physician who is in the hospital every day. My opinion, you should get vaccinated. That's the only thing so far can prevent the infection from getting us to the hospital, giving us intubation, or killing us at this point. Now, thankfully, there are many things coming out, like the monoclonal antibodies, like the antivirals, tablets. All of this are going to help us a lot. I want to say one other thing to all the people who are in the churches. Please do not close your churches. I urge you. Closure of the church is worse than the virus. The virus is here to stay for the coming 3 years. I assure you, we are not going to get rid of the virus that soon. So do not get panic. And every time you have 20 people getting infected, I hear people are closing Sunday schools and churches and meetings. Take precautions. Ask people not to come if they are infected. Unfortunately, we are all going to be infected one way or another. Do your best, but don't panic and don't let the virus control your life. We need to survive and we need to enjoy life. Depression is worse than the virus. Cancer is worse than the virus. So people who don't want to go for their mammograms and CAT scan of the chest and visiting their doctors because they're afraid, believe me, as a cancer doctor, I am seeing people who ignored their cancer for a year. And now we are seeing worse stages because we haven't seen these patients for a year and a half. This is worse than the fear of the virus. I wish you all the best, and I hope you stay safe. Until we meet again in Family Matters, God bless, and thank you.